Hello everyone, welcome, good morning. Thank you all
Good
for
morning.
joining
Good
me
morning.
today. I'm Raji Vivek for the newcomers. We have this session every
Good morning.
Friday.
Good morning.
It's stress relief, yoga for stress relief. We conduct this every Friday, 1 hour, 15 minutes. So today is a special lecture by our beloved Dr. Vidya Deshpande. She is a homeopathy doctor and she is a yoga therapist, yoga therapy consultant. And a little bit about her profile. We are so gifted to listen to her today. She has 25 years experience as a resident medical officer in naturopathy and yoga cure center, Arogyadham in Nashik, and she is awarded Yoga Ratna from Yoga Vidya Gurukul, my university in Nashik. And I've met her during my examinations for advanced pranayam course, advanced meditation course. That's how I came to know about the beautiful person. She is always willing to help, ready to share her knowledge. So without any further delay, I would like to invite Dr. Vidya. Hari Om, Dr. Vidya. If you can turn on your video.
Hari Om. Hari Om, Radhiji.
Yeah.
Hari Om, Doctor.
Good morning, good morning.
Hari Om.
Thanks for calling me in your satsang. Today, first I think we will take Omkar chanting. Yes, no? And then we will start our lecture.
Thank you, doctor.
Yeah. All of you ready for chanting? See, there are different types of Omkar chanting, different way in different institute. In our Gurukul, I think all of you know, many people are from Gurukul, they know how to chant Omkar. The Gurukul style, that is A, U and M. 2 seconds for A, 3 seconds for U and 5 seconds for M. What is the scientific reason? I will tell you later. But first, we will chant Omkar and we will take experience what we feel. And for that, first I will chant prayer, then I will chant Omkar, you follow me. Where you want to sit, on the chair, on the floor, on the bed, no problem. Sit comfortable. In Padmasana, in Swastikasana, in Sahajasana, any asana which is comfortable for you. Keep your back straight, hand in Dhyan Mudra, that is index finger and thumb, the tip of index finger and thumb touch together. Keep your hand on your thighs. Close your eyes. Relax whole body from head to toe. No any thought in your mind. Full body relaxed. See Omkar in between eyebrows or Ajna Chakra. Chant Omkar after me. After some Omkar, I will stop chanting. Then you chant yourself in mind. Means while inhaling Om and exhaling Om, not Om. That time you must chant Omkar in mind while inhaling Om and exhaling Om. After some minute, you feel that there is, I don't want to chant Omkar, I'm not looking Omkar, and I feel happy. Happiness is there for 5 to 10 seconds like this. Again, some thoughts come in your mind. Again, you start chanting Omkar in your mind. At last, I will say a little prayer and we will stop. Okay, ready? Inhale, deep inhale, deep exhale. Again, deep inhale,
घे राजा राजा हे बाळा घे
exhale. Please
तुझा
mute
करतो
your,
ते
please mute your microphone. Whole body is relaxed. No a single thought in your mind. Only are looking Omkar, eyes, hearing Omkar and chanting Omkar. I will say the prayer. You only listen. Omkaram bindu sanyuktam nityam dhyayanti yoginah कामदं मोक्षदं चैव ओंकाराय नमो नमः ओंकाराय नमो नमः ओंकाराय नमो नमः
Now, mind. Inhaling, exhaling.
Hare Murari. Nina Sham, Sham. Is the posture. Keep your palm on your eyes, open your eyes and relax. How you feel? Good or no?
Very Sai.
Yes,
Sai,
good.
there
Then
is
say like
a audio
it.
disturbance. So if you can keep the mic closer, or if you can use a earphones if you have.
Oh, I have no. The internet is not correct.
The audio keeps going in and out.
Now,
Yeah. Is it the same with everybody? Yeah. For me, the
Yes,
I
audio.
think
Raji.
it's the fan. I think it's the fan.
Yes, Raji. Some sound is coming. Some
Yes, audio is breaking.
Yeah,
waves.
it's
now also.
It
See,
sounds
now
like it's
also.
some breeze.
No, it's not there
आजूबाजूला
now.
वारं खूप आहे का? वारं खूप आहे का?
No, it's stopped.
वाऱ्याचा
It's
आवाज
stopped
येतो.
now.
Yeah. And even
Stop.
You
your
speak.
video. Yeah.
When she
Hario,
speaks, it's
Hario, how
happening.
are you? How you feel now?
Very nice.
it's nice.
Divine.
Okay.
That's coming when you speak.
Yeah, it's a fan sound. I think so.
Now it is breaking. My voice is breaking.
Not now.
No,
No. Okay.
voice is not breaking, but there is background sound, some kind of breeze or something like.
It's okay. Let's carry on.
Okay.
Uh, Sai, her video is freezing for everybody. It just comes frame by frame for me. Video is okay
No, it's
for
fine.
everyone.
It's
Yeah, it is.
Fine.
Maybe Sai,
Yeah,
if you
otherwise, I
can,
will change.
Yeah, it
if you have,
is. There is a latency, even I see.
yeah.
Then I
Thank
will
you,
close
everyone.
my video.
Is there any other connection you can try?
Yeah, I
Like
have
mobile
connection.
phone?
I have one connection, another connection. I will start.
Yeah. Take your time.
Yeah,
It's lovely to see everyone.
yeah, just a minute.
Today
Take
we are
your time, guys.
48 of us. Wow.
वाऱ्याचा
Wow.
आवाज खूप येतोय बरं का बॅकग्राऊंड मध्ये.
वाऱ्याचा येतो का?
हो, वारे
Okay, then I will close my fan.
Yeah, I think it's the wind. Yeah.
Wind, yeah.
वाऱ्याचा आवाज आल्यामुळे कट होत होता. ओंकार अजिबात ऐकू येत
Just a
नव्हतं.
minute. Just a minute.
Can't imagine sitting without fan in summer. Sorry, Sai.
Now it is good.
Yeah.
हा.
Okay.
हाँ ठीक है.
हाँ. Hari. Yes, how you feel, all of you, good or not?
Divine.
Divine. Very good. Why divine? Because
It
while chanting Om,
within. Yes.
yes, while chanting Omkar, first thing is the secretion of serotonin is increased. And what is the serotonin? Serotonin is the happy hormone. And this happy hormone secretes 10% only in the midbrain and 90% in the intestine. And when we feel, yes. No,
व्हिडिओ
open
नीट
your
येत
mic.
नाहीये. व्हिडिओ इज नॉट कमिंग मीन्स शेक होतोय व्हिडिओ आणि आवाज दुसरीकडनं येतोय असं वाटतंय.
So maybe you can switch off the video and just
Yeah.
Yeah, no
during the
problem, no
lecture.
problem.
That is better
Yeah,
actually.
no problem.
Okay.
Now,
Okay.
see,
Yeah, it's better now.
very good, no problem.
Okay.
Okay. Then see why we are feeling nice because of the serotonin which is secreting in the midbrain only 10% and 90% in intestine. And this serotonin is a happy hormone. First thing, when you are happy, 50% or more than 50% your disease get released. You feel better. See, if your knee is paining, if your headache is there, and your husband or your wife say, today we are going for movie or going for dinner, how you feel? Immediate, your headache will be stopped, knee pain also, and you will say, oh, no problem, I'm ready. Why? Because I'm happy. When you are happy, 50% your disease will go. So be happy. Then how we can happy? Easy answer is chant Omkar every day for 15 to 20 minutes. Then my son will change, my wife will change, my husband will change, nobody will change, you will change. So you must chant at least 15 minutes Omkar daily for your happiness, not for other. Not only the serotonin secretion is there is also the oxytocin secretion. And oxytocin secretion is the love hormone. What it do? Then the love hormone secretes. It is good for again to cure the disease. Also, it is good in breastfeeding mother. The oxytocin secretes what? Milk for mother. I am treating 25-bed hospital in Nashik, 50-bed hospital in Gurukul. In 25 to 27 years, I'm working with Guruji and I experienced more with him. The ladies came, they have no milk while breastfeeding because of stress. Only chanting of Omkar, the milk started in many ladies. Also, the oxytocin help for conception. In infertilities, everything is normal. Chant Omkar, the oxytocin, which help to bring that embryo from fallopians to uterus. This work is doing oxytocin. So oxytocin is also very important in our life. It's a love hormone. Why we want to chant for 2 seconds, Mu for 3 seconds, and Ma for 5 seconds? Because the vibrations of Omkar, its effects on lower part of our body, means lower back and both lower limbs. U affect on spinal cord and heart, and M on the brain. Then my knee pain is there. Then I should chant longer. My heart problem is there. Then I should chant longer. No. The answer is no. Why? Because the brain is controlling whole our body. So you must chant for 2 seconds, whatever you have menstrual problem, chant more longer. If you have heart problem, chant more longer. If you are diabetic, chant more longer. Means 2 seconds, 3 seconds, and more 5 seconds. All centers of our body on the brain. So Makar stimulates the neurons of our brain. And so all the centers work normally. All the diseases are psychosomatic. Means I have thyroid problem, it's a psychosomatic. I have pancreatic, means diabetes, it is psychosomatic. I have menstrual problem, it's psychosomatic. I have anxiety, it's also psychosomatic. Many times the mental problem is 30%, 40%, 50%, 80%, 90%. And physical, again, 40%, 30%, 80%, 90%. But this is a combination. Psychosomatic. All these diseases are psychosomatic disorders. I have thyroid. Why the thyroid is there? The doctor said that your thyroid is hypothyroidism or hyperthyroidism, that thyroid is not releasing properly, T3 is not normal or less or more. Why you have diabetes? Because the insulin is not secreting my pancreas. Why you have anxiety? Because my adrenaline is secreting more. Why you have menstrual problem? Because the estrogen progesterone level is imbalanced. These all diseases because of hormonal imbalance. And these all endocrine system have one main queen endocrine, that is a master gland known as pituitary. Pituitary control all these endocrine system. But the queen is there, then the king also there. Who is the king? Hypothalamus. What do the hypothalamus? The hypothalamus balance all our mentality, all emotions, weather change, food change, anxiety, all these things it control. But when the hypothalamus can't control all these things, then he disturb pituitary. Then the pituitary disturb to pancreas, thyroid, endocrine, any endocrine system, any endocrine gland, and the disease occurs. But no any pathy work on hypothalamus. The hypothalamus is the limbic system. Limbic system is the hypothalamus. Then in the limbic system there is thalamus. Also there is what you say amygdala. These all are the limbic system, and this limbic system have emotions, behavior, negativity. If they're in the limbic system, that affects all these things to limbic system and the disease of. But many people, they are always negative. Their behavior is not proper, very emotional. Then immediate the limbic system disturb, and it disturb to all the endocrine system. Not only endocrine system, but it disturb whole health. And this Omkar chanting, the Makar, affects on this limbic system. This hypothalamus. Automatically, all this problem will cure if you chant every day at least 15 minutes Omkar, 15 to 20 minutes Omkar. Another thing, while chanting Omkar, it's deactivated this limbic system. The connection disconnected. And so you feel better. You feel nice. It's also deconnect DMN. DMN is a default mode network. Default mode network means always, many people are always thinking about bad thing. Sorrow, sadness. See, when you are sitting here in front of me, still you are thinking of past tense or future tense. Those who are in present tense, they are happy. Why we are not happy? Why she do with me like that? What will happen tomorrow? Chinta, kaळजी. This you will get disease. Always think what is going on now. Live in present tense. Yoga is teaching you that stay with your body. Where is your body here? Then you must. Why you are thinking yesterday or past? Don't think. Not the past will not change. Then why you are thinking? And you are taking tension of future. Why you are taking tension of future? So relax. And this the Omkar help you to stay in present tense. When you are in present tense, then you will be happy. So this monkey mind, I said that monkey mind, the monkey mind is always disturbing you. And to disconnect this monkey mind, the Omkar is the best. Those who are always in anxiety, always in depression, say Omkar every day, half an hour, no problem. In our gurukul, in our ashram, in our naturopathy center, every day we are taking half an hour Omkar, 2 times a day. See, 2 times a day we are taking Omkar. And so there is no depression, no anxiety, no insomnia. Within 2 days, the patient say, oh, I am getting sleep good without medicine. 50% we reduce their medicine of anxiety or depressions also. You feel calm and quiet after chanting Omkar. And so this will good for small children also, those who are going to school. When they feel calm and quiet, they study well. The concentration will be there. The attention will be there. We have done one research on that. We took 50 students of 5th standard. 25 students only chanting Omkar and doing yoga, doing study and food. And 25 students no Omkar and they study same teachers, same food cell. But those students are chanting Omkar, they get 10% increase in their marks within 1 year. And those students not chanting, they are on 52% only. 1 to 2% they increase only. Some students. Hence, after chanting Omkar, at least 15 minutes every day for 1 year, you will get 10% marks. Why it occurs? Because of concentration of the students. It's increased the grasping capacity and attention. This Omkar chanting also affects on frontal cortex of brain. It activates the frontal cortex of brain, which is good for learning, coordination, behavior, and it also sends impulse to each organ to improve their work or improve their function. So many times the patient admitted in our center, or I have diabetes, or somebody says I have hypertension, somebody says I have only backache, or somebody says that I have only anxiety. One or two diseases they write in our case paper. After 5 to 10 days, they said, oh, I have written only my knee pain, but my blood pressure is normal. It's going below high because of that. 80 to 90% people want to stop their medicine of hypertension. If the patient is taking insulin, 20 units, within 10 days, they come to 10 units. 50% medicine of diabetes and 80 to 90% medicine of hypertension we want to stop. Why? Because the Omkar chanting, the frontal cortex is activated and it sends the impulses to each organ to improve their function. See, Miss Omkar chanting is so helpful in our all functions of the body. It also secretes dopamine. What is the dopamine? Dopamine is good for stability. Means if your dopamine is good, then you will do the asanas good. Sthira sukham asanam. Sthirata लाने वाला है. In which patient there is no stability? In Parkinson's. Why? Because the dopamine secretion is less. So they are taking dopamine tablet, dopamine medicine. 2 times, 3 times, 4 times also. And Omkar secretes dopamine. And dopamine again secreted by adrenaline gland. Why the anxiety is more? Because of again dopamine less. The adrenaline gland secretes adrenal. Adrenal gland secretes adrenaline more, so the anxiety is more. If the adrenal gland secretes dopamine more, then the stability is there. So the chanting of Omkar reduce the adrenaline secretion and increase the dopamine secretion. So you feel stable, better, sit like this. After chanting Omkar, you feel that I don't want to open the eyes. I like to sit like this only. Why? Because of dopamine secretion. स्थिरता लाता है जिंदगी में भी और शरीर में. It good for concentration, steadiness. Again, while chanting Omkar, what you feel? That is a parasympathetic nerve stimulation. The parasympathetic nerve, what they do? They reduce the blood pressure, they reduce your breathlessness, they reduce your pulse. You feel better. You feel calm and quietness. So, after chanting Omkar, if you see the blood pressure, you will get the result. I have done I have taken one camp for hypertension patient. 20 patients was there. All patients are taking medicine. With medicine, their blood pressure is 140 to 90 and above. Nobody below 140, 90. Like this patient, I have 20 patients for 1 month Omkar chanting every day offline. Every day they are coming chanting half an Omkar with me, and within 15 to 20 days, 80% of them I completely stop the medicine. 20% of them, 10% I reduce half, and 10% I can't reduce because the problem was not only the essential hypertension, it was a problem in kidney. So I sent them to physician. Means essential hypertension is there, 100%, we will stop the medicine. Without medicine, only chanting Omkar, we keep the blood pressure normal. Because of the parasympathetic nerve stimulants, it reduces the anxiety, it reduces excessive heartbeat, the heartbeat is more, it reduces. Omkar chanting reduce the cortisol, which increase the stress. So after chanting Omkar, you feel better. Exam going students, we advise them to chant Omkar 21 times and then go for exam. See how you feel. Because of stress, they forgot everything. The examination funk is there. To reduce examination funk, chant Omkar at least 21 times before your exam, before your paper, and see what you feel. Because the stress release, the student write their paper easily. Another thing, the after chanting the Omkar, what happened? The swelling is reduced. Anywhere in the body, if the swelling is there, you see or you keep your hand on that swelling. If knee pain is there or swelling is there, keep your hand and chant Omkar. There is anti-inflammatory. Anti-inflammatory is NF-kappa B, which reduce the inflammation. Also, endorphin secretion is there, so the pain is also reduced. Many times, what happens? The first 2 days, those who are coming in Gurukul, our ashram, they know the no tea, no spices, nothing. So, first 2 days, they started, headache is there. The patient started complaining that the patient and also student, we have headache. Then they are not coming for chanting Omkar. It's compulsory, I call them and sit and chant Omkar for 15 minutes and what you feel. They said, oh, my headache is not there. My migraine is not there. Why? Because of endorphin secretion. Endorphin is the best painkiller. And so they get relief. The headache is not there. Also, if you have pain, you close your eyes, concentrate on the painful part and chant Omkar for 21 times. What you feel, see. Immediate you get result. But it's temporary for 5 minutes, 10 minutes, 15 minutes, 1 hour. Then chant for 3 times a day. Only chanting for 5 minutes or 5 Omkar, you will not get the result. Chant at least 15 to 20 minutes Omkar. When you want a result, we are taking every day half an hour Omkar of patient in our center. In the morning, half an hour in the afternoons. In 2 times, 1 hour. Every day 1 hour. So we are getting the result. Not chanting only 11 Omkar. We have no time, so I have taken only 11 Omkar. Otherwise, I will take 30 minutes Omkar. Then you will get result. See, if you chant only 11 times, you feel better. What will happen if you chant for half an hour? So it's a best painkiller. It's a best anti-inflammatory. One thing more, that the melatonin secretion. Our pineal gland secretes the melatonin. What's the melatonin? It's a good for sleep. And when it secretes, when you close your eyes in the darkness, the melatonin secretion starts. Nowadays, lot of people have insomnia, sleeplessness. Why sleeplessness is there? Because of we are looking the screen for late night. The laptop is there, TV is there, mobile is there. Those who are suffering from insomnia or sleeplessness, you must do one thing. Close your screen at 8 o'clock before going to bed 2 hours. At 10 o'clock, you go and you chant 21 Omkar and sleep. And tell me, do same thing every day for at least 15 days, not one day. Every day, from today you start, and after 15 days, call me and say what happened. But your mobile, your laptop, your TV, shut down at 8 o'clock before going to bed 2 hours. It's 21 times or 51, you chant Omkar. If you are chanting Omkar, after 11 you are getting sleepy, go and sleep. If you are not sleeping, you chant at least 21 to 51 Omkar. No problem. Immediate, you will get sleep. Because of melatonin secretion. That melatonin secretion will help you for good sleep. Also, the Omkar chanting is best for asthmatic patient. It increases lung capacity. All of you know your lung capacity is 6,000 cc and only 500 cc we are using. Inhaling, exhaling. Deep inhalation and deep exhalation. That time we are using 4,000 cc of our lungs. Otherwise, no. While chanting Omkar, we inhale and chanting Omkar for 10 seconds. That time we are exhaling. Because of this, our lung capacity also increased. Because of Makar, nitric oxide secretions, which is good for viral infection. Viral infection is there, chant Omkar, the nitric oxide secretion is there. Our lung capacity increased because of Omkar chanting. Lot of patients, those who are coming, those who are taking the spray every day 2 times. We give some naturopathy treatment, we give pranayam also, but we ask them to chant Omkar every day. They have no capacity to chant Omkar in 10 seconds. They are chanting Omkar in 4-5 seconds first day. While going, they are chanting 8 to 10 seconds. One Omkar means their capacity is increased. They want to stop their spray within 7 to 8 days. So in asthmatic patient, Omkar chanting is best. One research is there that those who are chanting Omkar at least for 20 years, see what I am telling, those who are chanting Omkar at least for 20 years, the volume of gray matter means the neurons, you say, neuron of the brain, that thickness, the volume is increased. And what happened? The volume is increased, then there will be no dementia, memory loss, good coordination. Then means good coordination means the coordination in hand and eyes, hand and nose, like this. And this I'm telling you because I have 2 people in my center. One is a volunteer Dikshit lady. She is working in our ashram for 30 years in naturopathy center more than 30 years. Now she is 90. And she have fibroid, lung fibroid 10 years back. Doctor tell us that you keep oxygen with you because within 2 years she want to give oxygen. Doctor told me 8 years back, but still she is working well. She's chanting Omkar, no dementia, the brain is very excellent, the memory is very sharp. Another is my father-in-law. He is also 91 years. Memory is sharp, but every day he is also chanting at least 15 to 20 minutes Omkar. Means the research is perfect. That gray matter will increase the volume of brain. See, all this experience I have seen here in Yoga Vidya Gurukul with Guruji. Every day we are learning new things from the patient. After giving the Omkar, what is happening, we are observing every day. Also the blockages. Many times the patient of ejection factor 25% or 35%, they came to us. Then we can't give asanas. We give only Omkar, listening Omkar and Yoga Nidra. In the heart patient also. When they only listen the Omkar, they cure those patients. The doctor told that after 1 year she will get better. The patient feel better within 1 or 2 months. The 25% ejection factor patient go up to 35% within 6 months. Only listening and chanting Omkar and Yoga. In heart patient, the Omkar is the best. Many cardiologists also keeping the Omkar chanting of Guruji's Omkar chanting in their ICU unit. And they say that the recovery of the patient is very nice, very good. The patient is recovering 1.5 month, after 1 month, after listening the Omkar, they recover within 15 days. So only listening of Omkar, chanting of Omkar, it is good for heart also. So like this, many experience I have. I've seen the patient is recovering after chanting the Omkar also. Then only listening. Many times what happens? The patient don't want to chant the Omkar. Means ADHD peoples. The children have ADHD. They don't want to chant Omkar. Then in that case, what we do? I advise to their mother, start Omkar chanting or keep the audio of Omkar chanting, Guruji's audio of Omkar chanting near the bed of your children and start every day, whole night, continuous. The children is listening Omkar. Within 1 month, they get listened. They said that my child is now steady, sitting for at least 5 to 10 minutes, listening, and also they are going to chant also the Omkar. So in ADHD, the Omkar chanting is the best. First, only ask the baby to listen. They can't listen in whole day. Then when they are going to sleep, then you start your audio near them every day, whole night, continuously. You also experience, if you have any child of ADHD, you will get the result. Then the memory also. Those students are always not studying or fail in some subject. Ask them to chant Omkar 21 times, then do a particular subject. For example, uh, my son is not good in maths. Then chant Omkar, then ask them to do maths. Particular time again, at evening 8 o'clock or morning 7 o'clock or morning 8 o'clock, every day same time. Same time chant Omkar for 21 round and sit for that difficult subject. Means 8 o'clock we chant Omkar, 21 Omkar, 8:15 I sit for maths. To 9 or half an hour. Again, tomorrow same. Like this, if they do for 3 months, they will expert in that subject, expert. So this is good for children also. This is good for all type of patients also. This is good for old people, those who are getting dementia or memory loss, short-term memory loss, long-term memory loss. If they don't want, they must chant Omkar every day at least 15 to 20 minutes. Okay, I will stop now because I would like to give answer whatever you have a question.
Thank you so much, Doctor. I have one question.
Yes,
There is regarding the viral infection, you mentioned secretion of something. What was
nitric
that?
oxide.
Nitric oxide. And nitric oxide helps in the healing of arteries, endothelial cells
Yeah.
as well.
Arteries also expanding also. It's good for hypertension also. Yes, right. You're right. Yes, Vaishali ji.
Ma'am, is there any study, research paper published where it is said that Omkar chanting increases all the happy hormones? Or it is our own study or experience? Or is there any paper published in this matter?
Yeah, you will get lot of papers in Google also. But this is our experience.
Okay,
This is
okay.
our experience. But you will
Okay.
you search, you will get lot of papers on it.
Means
Just
is there
want
any
to add,
Serotonin and Omkar
study?
chanting. You
Ha,
serotonin and Omkar chanting like this.
But
Yeah.
as per in your lecture, you have not included any research paper based lecture.
No, I have no research. My experience is
It is
myself experience. Yeah.
self experience.
Yeah.
Okay, okay,
Self
okay,
experience. Yeah.
okay.
That
Thank
is a
you.
must. That is
Yes.
very important because I am thinking about a research paper in lot of many institute. Only one people get uh, what you say result. They make a
Hmm.
paper. The research
It
paper
means
at least
there.
30 people should be there. At least 30 people.
It means
And we
that
are
there
doing
there is
now up to now 40,000 people.
there is a need to do this research. I think no.
Yeah.
Means,
We want to do, but we want people. If you are coming forward, come. We have a lot of paper. You do all these things. We have no
yes,
time because
yes,
I want to see the patient more. I'm not interested in research. Those who are
ma'am.
interested, no, those
Yes.
who are interested, come here. We will give you
Okay.
paper. We will give patient to whatever you want.
Okay,
No
ma'am.
problem. Yeah,
Thank you
yeah.
so much. Thank
Anytime,
you.
anytime.
Okay.
just to add, Vaishali, I have done research for hypertension. I was presenting a article where I went through Omkar, and I think you are from SVYASA as well, right?
Yes.
MSRT and
Yes.
Omkar. There
Yes.
are whatever Dr. Vidya mentioned, there is a research paper. I was so surprised. Omkar has been highly researched, and all this endorphins, nitric oxide, happy hormones, everything we find people.
Yeah,
Just go to
we are
PubMed
doing
and
we are doing 40 years this. Guruji is working 40 years. I am working 30 years. Same we are doing. But we are only concentrating on the patient. We are
Ah.
not interested in research.
So what is happening? International community says where is the scientific proof? So I
Yeah,
want to
no,
do
no.
this research actually.
Yeah, that's perfect. But if you have problem, you come here. We will treat you. Look on research. What is going on?
Ah, okay,
We will
ma'am.
only treat. We will cure you only. That's
Yes,
because we
yes,
have not time to research.
yes. Okay.
Yeah. Uh-huh.
Doctor,
Uh-huh.
this is Indu Kapahi. I've been trying to
Induji.
contact you. Huh. So
Yes,
can I
yes.
call you after the class because it will take up now
Yes,
time
yes,
for
yes, yes. Call me, call me. Anytime you should
immediately
call
after
me. My number you take 9420 484015. Anytime you should call. If I am
same
free,
number
I
now
will.
that I have.
Yeah.
Same number now that I have.
Yeah, yeah, yeah,
Okay.
yeah. Yeah.
I'll call you immediately after class. Okay.
Yes,
Thank
yes.
you.
Ma'am, please repeat your number.
9420 484015. 9420 484015. Anjana ji. Yes. Yes, Anjana.
I just want to know, you said something about good coordination. I think Raji replied to that. Is it?
Yeah. Correct. Okay.
Can't hear you.
Yeah. Raji explained you, I think, no? Yeah.
yeah, that is the dopamine secretion that
Dopamine, yeah.
helps with
Coordination, yeah. For coordination. Correct.
Sai, we have some questions on the chat.
Thank you.
Yes, ask.
Yeah. Krishna is asking, is it okay to do half an hour Omkar before bedtime as well?
Yeah, no problem. No problem. You can chant Omkar anytime, but don't chant immediate after lunch or dinner. So if you want to chant Omkar before going to bed, you take your dinner at least 7:30. Before 2 hours of chanting Om.
What about the special need kids? Do we have
Special?
any research? Special needs,
No,
like
sorry, special?
special needs, I think like Down syndrome,
It's
kids
not
with
effects more. Not effective more. In Down
not
syndrome, mentally retarded, 25 ladies was there. 15 years back. I'm going to take Omkar chanting of them. I see little change in them. First day when I go to take Omkar chanting, I started Omkar chanting. I said, close your eyes. They can't close. Then I close my eyes and I look like this with one my eyes. They are also looking to me with one eye open. Then I open the eyes and say, don't open the eyes, close. Then I close. Then I don't open because they are opening. So I close and I started chanting Omkar chanting. 1, 2, 3, 4, 5. After 8, 10 Omkar, nobody is chanting. Why they are not chanting? I open the eyes. Some 4 ladies going playing there, some 4 going there. Mentally retarded ladies of 30 years, 25 years, 40 years ladies. But like a play group, they go and they are playing there. I'm alone sitting and chanting. This was my first day. And last day, 30 days I'm going. Last day, continuous 15 minutes they are chanting Omkar with. This was the result. No much effect there, but little effect is there in Down syndrome and in mentally retarded on this.
we can try that night Omkar playing the audio of Guruji for them, just as added.
In lying position.
Yeah, night time for ADHD you mentioned, right? The same
Yeah.
thing can be do
No,
play
why
continuously.
you are doing at night time? Any reason? I have no sleep good, so I am chanting. I have no time whole day, so I am chanting. But the best time is early in the morning. 3:30 is the best, I will say. In the early morning, Brahma Muhurta, we say Brahma Muhurta. At that time, the oxygen level is more. All the Rishi Muni is chanting or sitting in dhyan, in meditation that time. Nobody is disturbing you. Less subject in your mind in the early morning. Nobody is coming. You don't want to switch off your mobile. Everything is good at that time. So the best is early in the morning, 3:30 to 4. Second time in the day is if you are what you say housewife and like this, everybody is going in office, then you sit calm and quiet at afternoon 3 to 4. Otherwise at last is before going to bed. You see in your home which good time for you, nobody is disturbing you, that time you should sit and try.
Thank you. I hope, Krishna, that answers your question. You can type again if you have more. Revati is asking, one of my relative feels dizzy and have headache while chanting Omkar. Why does that happen?
Because of chanting Omkar, first thing is if they are not chanting proper, how they are chanting, you see. Many times what happened? The patient said that I have, when I am started chanting Omkar, my blood pressure is increasing. Then I call them, sit in my front and chant Omkar. How you are chanting, I want to see. How they chant, you know? This increases the blood pressure. Like this, first you see how she is chanting. Something is going wrong. And also see when she is chanting. She is drinking water or not. If she is drinking less water and chanting, that is also not good. Ask her to drink more water and then chant Omkar. Whole day, not only during chanting the Omkar. Anytime, whole day, she is taking less water and chanting Omkar. She is not chanting Omkar properly, or she is not inhaling proper and chanting Omkar. That is also important thing. No? Most of the people, they not inhale properly. Half inhaling, they start chanting Omkar. Inhale deep and then start Omkar. So see, something is wrong with her. Otherwise, send them to me. I will see what is wrong.
Thank you. Bye. Ekta is asking, can we do chanting anytime, anywhere? I think you did answer.
Yeah.
Not
Anytime,
after.
anywhere, but after lunch, immediate don't try.
Anjana's question is answered. It's the dopamine secretion helps in coordination. Shilpi is asking, what do you suggest if someone has religious issues for chanting Om?
That is problem. Then do primary pranayam. It will not get 100% result of Omkar. Tell them, see, it's a religious. Who is telling? I don't know, because all the foreigners they are chanting. In our Nashik, one Muslim school is there. See, they call me for madam, take lecture on concentration for students. All the ladies, those who are come to take me in that school, they come with burqa. I went with them. I'm thinking, what should I tell? What should I tell? Because Omkar is the best for concentration. How should I say Omkar in Muslim school? I went there. I sit, they start their Quran, some panktis and all these things. And the principal tell me that, madam, you start your lecture. What lecture I should take? I told about deep breathing, some asana, some things, and I'm not happy because I'm not telling Omkar to them because they are Muslim. They can't say. So I said, okay, sir. Then 5 minutes remain. The principal come to me, madam. Why you are not telling about Omkar? I said, can I? Yes. Why not? They said, see, your Om is like this. Our Allah is same like this. See, Allah they wrote like this, no? And Om will wrote like this. You said no problem. Then I take permission from them for more 15 minutes. I explained them. Then they said, please take at least 10 15 Omkar from our students. I took 10 to 15 Omkar from that student. You don't think about religious, you think about vibrations. Because all foreigners, they are coming in our ashram, they are chanting Omkar, no problem. You don't think about Ganpati and Shankar and Vishnu and Allah. You think only about the vibrations, universe sound. So don't think about it. You explain that if they want. I have one lady, Banu Pathan. She was pregnant last year. She is coming offline. 1 hour she is doing asanas, prenatal, and 1 hour she is sitting for Omkar and meditation. Whole 9 months. Banu Pathan. Now she is also in touch. Her husband is in army. So no problem. Those who want, you chant. You don't want result, don't chant. No problem. हाँ, उनके पीछे लगने का नहीं, करना है तो करो, चाहिए आपको रिजल्ट तो करना, तो है ना, गोलियां इतने देते रहो, गोलियां, कुछ प्रॉब्लम नहीं.
And just to add, Vidya, I started teaching in Abu Dhabi, UAE, where we have mostly Muslim, other religions. So I was very
One time,
apprehensive.
only one time you explain. Those who want, you chant. You don't want, don't chant. No problem. You do your namaz. If you get result, okay. No, then do asanas and see asanas, pranayam. You get result then. But this will 100% you will get result. Those who want, they will
Yeah.
chant. No want, don't.
Just to add my experience, all are open-minded, and I tell them yoga is before all the belief systems,
Yeah.
before all the religion. So then I give Omkar or Brahmari, and I see they automatically chant Om and feel the benefit and adopt without
Yeah.
any inhibitions.
Yeah.
So Shilpi can try that, explaining
And
them
if
and giving them
any Muslim friend you have, yoga teacher, call her. That is the best. Yeah, you will get.
Vaishali has a question.
This is useful in cancer also, no? Cancer patient.
Cancer patient.
Huh.
Yeah, yeah.
Omkar.
This best for cancer patient because always they are in depression, and it reduces the depression. So the cancer patient, they want to they give. Please, okay. The cancer patient advise them to at least 15 minutes they should chant Omkar every day. Then the recovery also get fast in them and no depression, nothing.
Vaishali had her hand raised. Go ahead, Vaishali.
Actually, yeah, actually, I wanted to add to ma'am. Ma'am, you told very nicely that all Muslims know they like to chant Omkar because it is not religion. It is
Yeah.
not related to religion. It is
Yeah.
related to sound and sound vibrations. There is no connection whatsoever to any religion over here because we are only chanting the sound. There is nothing like God or anything in Omkar. Omkar is
Yes.
just sound.
Yes. But still, I will tell you, 2-3 years back, I went to Kazakhstan as an examiner, and the Ekadashi was there On Ekadashi, we are reading the Bhagavad Gita 18th Adhyay. Me, myself, and my husband, we want to chant 18 Adhyay. We said, I am going to read our Bhagavad Gita. The Muslim country, again, the Muslims are there in Kazakhstan also. The ladies come and sit for 3 hours, closing their eyes. We are chanting, they are listening. Many people like this also.
Very nice, ma'am.
Yes, go ahead, Archana. We will take the rising hands and then I'll go for the chat question. Yeah.
Yeah.
If your answer is already answered, if your question, then I will not be repeating those questions. Yeah. Just to save time. Yes, Archana will go, then Supriya, you will go next. Yeah. Okay.
Thank you so much, Raji. Thank you so much, Vidya ji. Dr. Vidya, thank you. I have a question. You said that Omkar helps in Parkinson's because it releases dopamine, and
Yeah.
dopamine is what is given in the medicines. How, may I ask, how many times should it be done? Because
At
my
least
mom has got
3
Parkinson's.
times a day. At least 3 times a day. At a time, 21 Omkar minimum.
Okay. Because her voice has gone very down, and I'm talking about my mother. She's got
Yeah.
Parkinson's.
Ask
So
her to chant Omkar and also give her the cold and hot pack. Rajiji, you have done the therapy, no?
Yes.
You have done therapy?
Yeah, I've done.
Then you know the cold and hot pack for throat. Deshpande sir explain you.
Yeah.
That you give Archana's mom. That will help, and also chant Omkar whatever she can. Every 1 hour she can chant 11 Omkar. That is also good for her. And also asanas. Take asanas. You are yoga teacher, Archana ji? No, then
No, but
take
she
help of
knows.
Raji. Take help of Raji.
Yes.
Raji ji, take the balancing
I
asanas.
I know yoga, but I'm not a teacher.
Okay. No
Of course,
problem.
I
But
can.
Raji ji will take your
Yeah,
mother's. Yeah.
thank you so much.
Yeah.
Thank you.
Supriya, go next. Sureka ji, just wait. I'm maintaining the order. Yeah, I will. Your turn.
I just wanted to add, in Dubai, in my son's school, they used to chant, instead of Omkara, they used to chant hum. So it was like chanting Omkara in hum sound. So just wanted to tell
that only Makar will affect it. U is not there. So the vibrations is not there. Over 5 and 25.
Yeah.
Ask them to chant womb. That is good result.
Yeah.
Yes, Manisha, just go ahead.
Yeah. Shall I ask?
Yes.
Yes. Can you send Guruji's Omkar audio on our this group so that we can listen?
Yeah.
Huh?
Raji ji,
Okay.
you have Omkar Jap?
Yeah, I
She
have,
will.
but
She will send you.
Thank you very much. Thank you.
thank you. Yes, Sureka ji.
What about in acidity? It should not increase, no? If I am doing
No.
Omkar.
Acidity is increasing because of your food, your lifestyle, your stress. The cortisol is reduced, your stress will reduce, your acidity will reduce.
And in hormones also.
Yeah.
Hormone and imbalance.
Yes.
Okay. Thank you.
In short, it is a one-stop solution.
Yeah, correct.
So, Sai, just one thing. Is there anybody who should not do? Anybody, the chanting, listening, everyone can do, but chanting, if they have a nodule in their vocal cord,
Then only listen, but try to chant. I have one lady 4 years back. Because of one accident, only looking accident, her voice was gone completely. She show for all doctors, and she have tension, stress, and because of that, her voice was not there. And she came in our naturopathy center for 10 days. Gupta, her name is Gupta. And she started talking. She's a tailor. Anytime you can come here, I will meet her, or I will give you the number also. Within 10 days, she get result. So chanting Omkar is the best.
Thank you, Tay. So now we'll move on to chat question. Manisha is asking, I'm a 50 plus lady. I forget things very often. Will Omkar help?
I guess what things you are forgetting? That is very important. Which things you are forgetting? That if she is forgetting name, if she is forgetting numbers, different type of forgetnesses. Which type you see? But you should start chanting at least 20 to 30 minutes Omkar every day. And keep in mind that I don't forget anything. And then you start that. Omkaram bindu sayuktam nityam dhyayanti yogina kamadam mokshadam chaiva. Kamadam means whatever you want, you think and then chant. You are sitting and chanting. No, first you think. Why I am chanting? Only for happiness, no problem. I am chanting because I am forgetting. I don't want to forget anything. Then chant. You will get that. Why you are chanting? I want to reduce my blood pressure. I want to reduce my soreness and all these things you think and then chant. You will get result 100%.
Thank you, Tay. Audio question is answered. You can DM me, I will send. Raj is asking, my mom has initial stages of dementia. How many times we should chant?
2 times, at least 2 times. In the morning, 20 minutes, evening, 20 minutes. And talk with her. In dementia patient, you must talk all the times with them. And ask them, who is she? Ask things, present things with them. If you are not talking with them, then dementia will increase. Take chanting Omkar in the morning, evening 20 minutes, and all the times you should chant with them or give them newspaper. Tell them what is this news, you please read and tell me. I have no time, but please tell me. Give work to them. They are forgetting, so we are not listening them. We are not attending them. You should attend.
Thank you, Tay. Rohini Joshi ji, I didn't understand your chat thing. Maybe you can unmute and speak. I think you have wrote in Marathi. I'm not.
What Marathi is there? I will see. Okay.
मला देकर येते क्या मुले disturbance बता दो.
Where it is, I am not getting.
Little bit up. I will post it once again.
Ask them. Tell them to ask in Marathi also. No problem.
Yeah, you can talk to her in Marathi, Hindi, any language.
हॅलो हॅलो मॅडम
बोला.
मॅडम मला ना ढेकर येते सारखी म्हणजे
काय
त्याच्यामुळे
येते?
मला ढेकर ढेकर
ढेकर येते. ओके. बल्जिंग ऑल द टाइम बिकॉज ऑफ कारण का त्याचं तुम्ही तोंड उघडं ठेवत असाल जास्त. सर्दी वगैरे असते का?
नाही नाही
कारण तोंड तुमचं उघडं राहते म्हणून हवा जाते आणि हवा जाते म्हणून ढेकर येतात.
बरं बरं
हा, तर त्याच्यासाठी तुम्ही वेळेवर जेवणं आणि चुकीचं जेवण असेल तर बंद करा.
हा हा
कुठे राहता?
अंधेरी अंधेरी
अंधेरी. बरं, माझ्या नंबरला कधी कॉल करा तुम्ही, काय वाटलं.
चालेल चालेल हो चालेल.
ओके ओके.
And Vidya, if you can mention in English, a question just for all of us too.
What? No, she is telling me that bulging is there all the time. Why? It is because of irregular diet or irregular lifestyle or open the mouth whole night. Many people sleep like this. No? The air goes in stomach. So the bulging is.
हॅलो मॅडम
Vijay Kumar.
नाही पर्टिक्युलरली ओंकार करताना होतं मॅडम असं. ओंकार करताना मला डेक्कर येते.
ओंकार कसा म्हणतात ते बघायला पाहिजे. While chanting Omkar, she feel like this. Then we want to see your Omkar, how you are chanting. Something is going wrong. And when you are chanting, that is also important.
Okay, okay. That I will keep in mind.
After food, you should chant after 3 hours, after taking food.
Okay, okay. I will see that.
Okay.
And I would like to take this opportunity to tell all the newcomers, we at Yoga Vidya Gurukul, Yoga Point, every other month, our Thai, Purnima Thai does Omkar Dharana course, where she explains all this over the period of 12 weeks, and many of our participants joined and they benefited. It is very, very reasonably priced, and she conducts in English, Hindi, and Marathi. So if anybody wants to know the detail, just PM me. I will help you with that. Yeah. Thank you. And Vijay Kumari.
Manisha ji want to ask
बघा
something.
मॅम आय एम हॅव्हिंग मला संधिवात आहे. आय एम हॅव्हिंग जॉईंट पेन. तर त्याच्याकरता ओंकार उपयुक्त आहे का?
For pain relief, temporary.
Temporary. पण मग
you must come to ashram for treatment, because other treatments is also there. There is a massage, some asanas, some Ayurvedic treatments is there that you should take.
I am doing my all regular exercises, so that is okay, no? Regular exercises.
I don't know what you are doing. Because exercise, lot of exercise is there.
फिजिओथेरपिस्टनी जे सांगितले ते मी सगळे करते.
ओके, करा आणि हे करा. जर बरं वाटलं नाही तर या, बरं वाटलं तर याची गरज.
बर ठीक आहे. ओके.
Thank you. Vijay Kumari, finally, your turn. Unmute and speak. No, you have to unmute Vijay Kumari.
डॉक्टर, जब मैं चलती हूँ तो मुझे आई कैन नॉट वॉक स्ट्रेट. In this summer, in Abu Dhabi now summer has started, so when I'm walking I slant and walk because I feel very मेरा पीछे है ना बहुत stiffness है, as well as it goes to my brain. So how this Omkar will help me?
You are doing asanas?
Yeah, I do some asanas which physiotherapy.
No, not some asanas. You take class. Raji will take your class, Yoga Sanjeevan class.
Okay.
Raji, you should take the class for her. And also, not only Omkar chanting will help you, both Omkar chanting and asanas will help you, and lifestyle also you should train. You reduce your weight is, how much your weight?
My weight is like more than 75.
That also you should reduce. Your weight will be 60, you will be okay. 10 to 15 kg, you must reduce your weight. You do asanas every day. You change your lifestyle and Omkar chanting. Everything will be, all this thing will be helpful.
Okay, doctor. Thank you.
She is very sincere. She will follow through all. Good luck. And Supriya is asking how to consult you. Doctor, if you can put your phone number once again in the chat, it would be helpful.
Yeah, I will. You are taking class, Raji?
Yes, Thai. I'm taking morning, evening, and every Friday we do this session, the same time for senior citizens, mostly chair yoga and all that, and pranayam, Omkar.
Okay, because the patient, I will send you the form also for patient. Fill the form, take 500 rupees for Gurukul, and send their name. I will write all the treatment for them, for asanas, pranayamas, and diet, all, and I will send you, and you take class, and whatever you feel you should take.
Amazing. Thank you, Thai. Thank you for all this guidance.
Okay.
Any suggestion for cramps?
Any suggestion for?
Cramps, CRAMPS.
Cramps. See, the cramps is because
In
of the
Nasavan Nas Sadkana.
less minerals. See your blood pressure, see your hemoglobin, because of oxygen level is less, your this one, what you say, minerals is less, hemoglobin is less, then you will get.
Is
First thing,
water
why
water
it is
intake less? Water intake?
water. If water is taking less, if you are taking less minerals, if hemoglobin is not proper, this is the oxygen level is not proper because of hemoglobin. So see the reason first, then the treatment is easy. All for all diseases, first we must know the reason, then we will give the treatment, because lot of treatment is there. There's some asanas is there, some mudras is there, some pranayam is there, some diet is there, but what is the reason, then which treatment is perfect, that we will see.
Thank you. It was a wonderful session, Doctor. Thank you very
Yes,
much.
Narendra.
Thanks,
Yes,
Raji.
Sureka. Thank you. Sureka ji, yes.
For cramps, I am just suggesting, this is my experience, Varuna Mudra. It's immediately effect. It's getting immediate effect.
Yeah, then do Varuna Mudra.
No, I am doing. I am just suggesting her.
No, I am telling them.
Varun Mudra immediately, or sometimes Vayu Mudra also. Because of Vayu also, it's getting more cramps. If you have Vat or like that. So I'm doing immediately, it's getting results.
Thank you, Sureka ji. Thanks for sharing. I think with this we
Thank you.
concluded all the questions. Any other questions?
Yes,
Did I miss?
Rajiji, thank you for calling me.
I see Dr. Leena. She is a homeopath in Dubai, and she is a very active member in Arab yoga region, Arab for yoga instructors. Dr. Leena, if you are in a position to unmute and say a few words, it's so nice to see you.
Sure. Yeah, just saw your message in the morning and I said, let me connect, so I just connected. Yeah, Dr. Vidya, it was nice listening to your, I would say experience, not the research. As I hear, it is experience. And I totally agree because, I was also working with a research company earlier. But, research is sometimes so many papers comes and this, that, but this is her experience, which is more counted. And it's really wonderful to know about your experiences and how many different people. And she talked about like special differently able, special need lady, and exactly she said, a few days they'll go here and there, because I worked with them for 8 years, so I know. But yeah, it has an effect, when you do anything consistently. Yeah, there is an effect for sure. So it was wonderful knowing about your experiences, Dr. Vidya. And I was happy to have the questions also, because the questions, the way you answered, the answer was so from within your heart and what it was. It's nothing like, like and manipulation. It was so from within your heart and your experiences. I really loved it. Yeah.
Thank you.
It was
You
really
are from?
nice.
You are from in?
I am in Dubai.
Dubai, okay. In Dubai,
Yeah.
my friend is also there. Her name is Dr. Manisha.
Doctor, she's homeopath?
Yeah. But she is not practicing homeopath, but she is doing work in some hospital.
Okay, because I think I have a group of homeopaths where I have organized a whole group, so I'm sure that I know, but maybe
She
as
is
the
Indian.
name and
She
the
is
face
also
doesn't
Indian.
come yet.
Yeah,
Yeah,
she is
yeah.
also Indian. Manisha.
Yeah.
Her name is
Manisha.
Manisha. I think her surname is Gaudi or something. I forgot.
I know one Gauri. Not Manisha, her name is different, I think. She's Bopate. No. Acha, okay,
No. Manisha, the name is perfect, Manisha, but
Perfect.
surname I
Okay.
forgot.
So as she's
Because
not
she was.
practicing, because we are a group of homeopath, maybe she can be a part of that group. It is okay if she's not practicing homeopathy. Yeah. So you can, Rajesh, you can take the Manisha's number and she can
Yeah,
connect
I will
me.
send her. I will send.
Yeah. Okay.
I was
So
about
it
to
was
say
nice listening
that,
to you.
Thank you.
Yeah. Dr. Leena is a karma yogi. She's very active in yoga group, homeopath group. She was the, brain behind Ayush conference. She brought in all the doctors from India, second international Ayush conference. She was
Very good.
leading And in Abu Dhabi temple also, she's the coordinator. So it's a blessing to
She is
know
our
her.
teacher.
She does a prenatal yoga teacher, but not with yoga
I'm a volunteer.
point.
Yeah, volunteer for everything. Yeah.
Okay.
So please share her number with your
Yeah. I will
contacts.
share you the Manisha's number. Okay. Yeah. Okay. Thank you. Thank you,
Dhanyavad,
Dr.
dhanyavad,
Veena
doctor.
ji, Raji ji, and all of you. Thank you. Dhanyavad.
Namaskar.
Dhanyavad. Can I
Thank
leave?
you.
Thank you.
I'm just calling you. I'm just going to call you now.
Thank you.
Yeah. Okay.
Thank you, Vidya ji. Thank
Hari
you.
Om. Hari Om.
Thank you, ma'am.
Dhanyavad,
Thank you, Dr.
Raji,
ma'am.
Hari
for
Om.
wonderful
Thank
session.
you.
Hari Om.
Hari Om.
Hari
Thank